Appears COVID-19's grip on the U.S. is losing its strength. Hospitalizations have hit the lowest point since the start of the pandemic. Well, the Department of Health and Human Services also says the number of ICU patients is dropping too. So what does this mean for the future of the public health crisis, right? Here to talk about it is Dr. Simone Wilds, an infectious disease specialist at South Shore Health. Thank you for being with us.
Hey, Dr. Wilds, great to see you. So let's take a closer look at those numbers. The peak of hospitalizations was just a couple of months ago during the Omicron surge, when hospitals had more than 160,000 COVID patients occupying beds. Right now, that number is down to 16,000, a little over 16,100. Has South Shore seen a similar percentage drop?
Ed, that's a really great question. The decreasing trends that we're seeing across the country with regards to cases, hospitalizations, and death due to COVID is something that we're seeing also at South Shore. This is really great news, and we waited for such a long time to see such a decrease in trends. We really hope to continue on this path.
Yeah, okay. Clearly also, we know that COVID put a lot of strain on the nation's healthcare system. Do you think that threat is over for hospitals in the state?
Jessica, I think that, we are seeing clearly a decrease in the number of trends, but I must say that even though Massachusetts is in a very good place, we're not at zero. And so we have to continue to monitor things closely. We still have other variants out. Right now, we're talking about the Omicron subvariant. So the work really continues. The surveillance has to go on.
Dr. Wilds, data on hospital capacity shows that right now, statewide, 91% of medical or surgical beds are occupied, 91%, and 80% of all ICU beds. So I'm somewhat confused. Why are these numbers so high if the threat from COVID rests so relatively low right now?
And it's a really important point that I want to stress. Now, what we're seeing with the increase in hospital capacity is that there was a lot of care that was delayed by patients because of COVID, either because of choice or because the hospital just could not accommodate them. So right now, patients are going back to get the care they need, which is why we're seeing such an increased capacity. I'm really happy that patients are going back to get the necessary care they need so that we can get everyone healthy and well.
That's a great clarification. Yeah. It's not necessarily tied to COVID-19. Right. So that's a great clarification, Dr. Wilds. Thank you.
Dr. Simone Wilds, we appreciate your time as always. Thank you.
Great to see you. Have a good weekend.